This is a 30-year-old man who's here for revision of gynecomastia, meaning he's already had one operation and it's just not quite right. What he had done was just liposuction. There was no excision, no cutting out of tissue. So if you turn just a little bit this way, you can really see the extent to which this comes out. From front view, it doesn't look like so much. And then over here, you can see it on this side. And then the side view, you can also see it. Okay, thank you. Can you just turn back? So what was done was he had liposuction. They removed fat, but the liposuction doesn't remove the firm glandular tissue. And deep in this area on each side, you can feel this real firm rubbery stuff. That can only come out by cutting it out, by being excised. So what we're going to do today is, through a little incision around his areola, cut out that firm stuff, and then just do a little more liposuction to smooth everything down to give him a great contour. This gentleman's had prior liposuction for his gynecomastia, but he did not have excision. And so though this seems subtle here, when he's standing up, for a thin guy, this area here and this protuberance really sticks out, prohibiting him from ever wearing any tight shirts. So our focus today is going to be on doing some liposuction to reduce the whole area, and then this center area here, where he has this real particular protuberance, we'll make a little incision around the areola and we'll remove the firm glandular tissue within it. The first part of any liposuction is to start with putting in the tumescent fluid. We make a small incision hidden somewhere. In his case, there's some hair here, and it gives us good access. So we make a little incision out here. And then we take this blunt instrument and we just put gently in a little bit of fluid. And this fluid, see, it's very gentle. This fluid will stop bleeding and give long-acting pain control. So after we put this in, we wait just several minutes for the medicine to take effect, and then he's ready for the liposuction. So the tumescent fluid has been in for about 15 minutes. So you can see it's a little bit more raised now than it was before we added it. And you may see some white, I don't know if it shows up on the camera, a little bit of blanching from the epinephrine, which is one of the medicines in the tumescent fluid that helps shrink the blood vessels. This is the ultrasonic instrument. The ultrasonic energy is in here, and then it passes through this cannula where there's a little blunt tip at the end. And what the ultrasound does is it causes the fat at the very end to melt, and then we suck that fat out. We're going to use ultrasound in this man because he's a revision case, so his tissue is going to be more scarred. Ultrasonic liposuction can be helpful in cases where there are revisions such as him, and the scar tissue makes it hard to get the fat out. With the ultrasound, we'll get a better yield of fat. So we'll gently put the ultrasound probe under his skin. And then as we turn it on, it very gently passes under the surface of the skin. And you can probably hear it in there. What it's doing is it's emulsifying. It's melting the fat. And the fat that's going to come out is going to kind of look like melted butter. So we stop, we reposition. But note how incredibly gentle it is. It's really about sculpting and creating an ideal shape. So we'll do this for a few minutes until we have a nice shape to the chest. We're back now and the liposuction's complete. Remember, there was kind of a big hump here where we had put in all the wetting solution, but now it's much flatter, but not perfectly flat, because right here with my fingers I can feel this real firm, like a thick marble right here, and it just pops right out of my hand. I don't know if it shows up on the video. But what we're going to do is make a little incision around the areola and just pluck out that little ball, and then he's really going to be nice and flat. He's not going to have that little blip right there under the nipple. Okay, now we've done the excision. So we did the liposuction, and then we removed that little ball that we saw here before. So now everything is nice and smooth. And this is exactly the way we want to look at the end of the operation. For those of you that have a strong stomach, I'm going to bring into the field what we removed. So turn this off if you don't want to see it. Ready? All right, this is what we removed. This little bit of tissue was right there under the skin. Didn't look as, looks bigger than you probably thought because it was a little spread out and it had tissue covering it. But if you look at it, it's mostly this firm, white stuff. This rubbery stuff just does not come out with liposuction. So his first surgery in which they did liposuction, there was no way it was going to get that out. So he needed to have this excised in addition to the liposuction in order for him to have the flat contour that he's wanted. As a last step, we're going to put in some very long-acting pain medicine. And this way he'll have just a minimum of discomfort after his surgery. Next, for the dressing, we put little steri strips right over the incision. Incision isn't this long, we just overlap a little bit with the tape. Then we put some toppy foam, which is a foam that acts and creates a nice compression over the area. And then over this will go the vest. Now a lot of guys want to know what the vest looks like, and so here's the vest over the foam. And he'll keep this on for a couple of days.